Good afternoon, everybody. I think we have enough folks to get started, and Marcella, you're manning the waiting room, I think, so you can keep letting people in as they are able to join. Noon on a Friday afternoon. This is an impressive group already. So we purposely have this just for 45 minutes. It's a little bit less daunting than a full hour, both for participants and presenters. And I think that's a more appealing time frame than a full hour. So we'll make sure we will use it all, but want to be careful with the time. So I'm going to speak for very, very briefly and then pass this over to our actual presenters. My name is Eva Lathrop. I'm the current president of the board of directors for Konbit Sante. I've been a part of Konbit Sante for the long haul from the start, and have been a long time board member, and I'm feeling really privileged and grateful to have this role as president. This is my second year with an amazing board. And so because of that, I get to open. I was thinking about this presentation in both Perry and Tezida's remarks and about Haiti and Konbit Sante over the 22 years. And I would say that this year, while there have been incredible challenges, most of those are not resolved and don't have quick resolution in Haiti right now. There are incredible global challenges. For our work and Konbit Sante's work in Haiti, I feel most hope and optimism more than anything. And feel really proud of what we've done in the last 22 years, what we've done in the last 2 years, as the challenges mount more and more. So I hope that's conveyed in our presentations today, that more than anything, we feel resilient and agile and committed and hopeful and optimistic. We feel realistic about the challenges that we're facing and that Haitians are facing. But the spirit of the Konbit and of all of you is what will carry us through. I'm really excited to hear from both Tezida and Perry today. Tezida, the words of gratitude I have for her are impossible to convey to all of you, but they are many. Tezida functions as our director of programs and as our country director. But for the last year, she took the helm as our interim executive director and did an incredible job. Doing that with her other 2 jobs was just an incredible feat. She did it beautifully. She did it with incredible grace, and we are beyond grateful for her. I'm thrilled for her that she can now do her real jobs and not also hold the position of executive director. We're equally grateful to Perry Newman, who has recently started with us and from whom you'll hear today as our new executive director. We're just thrilled and feeling so lucky that all the stars must have just aligned for all of us, for Perry to become part of our Konbit. So we'll hear from him towards the end. But first, we'll hear from Tezida. And Tezida, with that, let me mute myself and pass the parole to you, so you can take us through some of the real nuts and bolts of our work in Haiti.
All right. Thank you, Eva, for the introduction, and thank you all for joining us today. As the title of today's presentation suggests, the defining feature of Konbit Sante is resilience. I started working at Konbit Sante in October of 2010, the year of the earthquake that killed over 200,000 people. Since then, there have been many more earthquakes, there have been hurricanes, there's been a presidential assassination, there's been political instability and violence. And through it all, Konbit Sante has remained in Haiti, supporting the delivery of quality healthcare to the poor. For over 20 years, Konbit Sante has partnered with and supported Haitian health professionals and Haitian health institutions through thick and thin. For those of you who are new to Konbit Sante, we are a nonprofit organization founded in Maine in 2001. We are a registered NGO in Haiti, making us one of the few among the thousands of NGOs working in Haiti that are officially registered and recognized by the Haitian government. Konbit Sante in Haitian Creole means working together for health. Konbit Sante's work is geographically located in one region of the country, in the greater Cap Haitian area in northern Haiti, the circle that you see on your screen there. Cap-Haïtien is the capital of the Northern Department, and it's the second largest city in Haiti. The greater Cap-Haïtien area has a population of about roughly 400,000 people. So before I go into my presentation about our work and our approach, I'll just address what's likely to be on top of mind for many of you, especially those of you who are in the US, and that is, what is it like? What are the day-to-day conditions like in Haiti, given news of political violence and unrest over the past couple of years? I live in Cap-Haïtien, and I can tell you that at least for now, our experience in Cap is markedly different from the capital in Port-au-Prince, where much of the violence and instability has been concentrated over the past couple of years. Except for a few weeks of largely peaceful protests over the price of fuel in September 2022, Cap-Haïtien has been safe and peaceful. We are not immune, of course, to the consequences and the fallouts of political instability in Port-au-Prince. We are experiencing high rates of inflation. Access to fuel and other goods and services is often unreliable. There is a growing sense of despair among people, especially young people, about the future. But physically, our day-to-day experience is one of safety and just general peacefulness. This is a great picture. I just wanted to throw it in about what day-to-day life looks like in Cap. It's an open market that's a few blocks from our office in Cap, as well as our apartment in Cap-Haïtien. And this is where you go if you need anything from seafood to car parts to medicine. It's like anything that you want is at this market here. So our mission statement is our statement of purpose. It's the reason that the organization exists. Konbit Sante's mission is to support the development of a sustainable health system to meet the needs of the Cap-Haïtien community with maximum local direction and support. So what I've done is I put in bold the parts or components of our mission statement that are, for me at least, are key and say that that communicate in essence what Konbit Sante is about. So one, a focus on sustainable health system. Because we are invested in long-term change, we are focused on systems rather than individual care. Two, Cap-Haïtien community. As I mentioned before, we are geographically focused on one community, allowing us to develop long-standing relationships based on trust and respect over many, many years. And three, maximum local direction and support. What that means is that rather than coming in with preconceived notions about what should be done, we come to solutions for change and improved care through dialogue with our partners. Konbit Sante works with 4 Haitian health facilities, 2 in the private sector and 2 in the public sector, with 1 facility soon to be added. Our current partners include Justinian University Hospital, Fort Saint-Michel Hospital, the Haitian Baptist Convention Hospital, and Unité de lutte pour la santé. And you can learn more about each of our partners on our website at konbitsante.org or by reading our annual report, which many have received by now. And if you haven't, you can look it up on our website. As I mentioned when I was reviewing our mission statement, we focus on health systems rather than individual healthcare. According to the World Health Organization, a health system is composed of building blocks, including a health workforce, so nurses, doctors, lab technicians, administrators, etc., a safe and clean space to deliver care, the materials, meaning the medicine, supplies, and equipment needed to treat patients, information or data to make treatment or policy decisions, funding, of course, and effective management and leadership to make all the components work in harmony and for the benefit of patients. This image here is taken from a World Health Organization report titled Everybody's Business, Strengthening Health Systems to Improve Health Outcomes. So on the left here are the building blocks that I just discussed, and they make up the health system. And the idea is that by improving these building blocks or components of the health system, the system ultimately results in improved care for populations and a more efficient and responsive health system that provides social and financial protection to households and individuals. So what Konbit Sante does is assess the component parts of a system, whether the system is an entire hospital or a department within a hospital. We determine the factors that are contributing to poor outcomes, identify and prioritize solutions based on existing strengths, help implement a solution and monitor its impact, all in collaboration with our partners. This chart shows the projects that we implemented in the last year by location, our partner facilities, and by health system building block. Because we're short on time, I will talk about 3 noteworthy accomplishments or projects in the past year, but I'm happy to take questions about any of our projects during the Q&A session. Among our notable accomplishments in the past year is the procurement of an oxygen generator for the Haitian Baptist Convention Hospital, or HCBH. Oxygen, as you all know, is an essential medicine that's used for patients at all levels of care. Like many health facilities in Haiti, HCBH purchases or has been purchasing oxygen cylinders, accounting for a significant portion of the hospital's monthly expenses. Over months of discussions over the past year about ways to both improve patient care and stabilize the hospital's finances, Konbit Sante, our partners at Hope Health Action in the UK, and the leadership of HCBH decided to procure and install an oxygen power plant that would ensure that patients have a reliable source of medical-grade oxygen and save the hospital money in the long term. Konbit Sante volunteers developed the technical specs for the oxygen power plant, and then we as an organization help raise the money and manage the logistics to ship the oxygen generator to Haiti. So this is what it looks like here, the oxygen power plant. The oxygen generator has arrived, it's in Haiti, it's now in customs and in the process of being cleared. Once the oxygen generator is out of customs, it will be taken to HCBH, installed there, and Konbit Sante will continue to provide technical assistance and accompany the HCBH staff as they integrate the oxygen generator into care delivery. Another notable accomplishment and project over the past year was our support to ULS, Unité de Lutte pour la Santé, to address the need for dignified and safe transport of patients by helping them procure a new ambulance. Konbit Sante was eligible to purchase an ambulance on behalf of ULS through a program run by Toyota that makes vehicles available to registered nonprofit organizations at lower cost. Currently, the majority of patients are transported to ULS on motorcycle bicycles or 3-wheelers like the one that you see here to ULS, whether they're coming to ULS from home or being transferred from ULS to a facility with more advanced care. They are being transported right now in either these 3-wheelers that you see here or a motorcycle bike. The ambulance, this is actually what is in customs right now, is in the process of being cleared. This ambulance will ensure that patients are transported to care facilities with appropriate medical support. And finally, I just want to highlight our work with Fort Saint-Michel Hospital to provide community-based services. One of the core elements of creating a sustainable health system is an investment in the health workforce. And for over 15 years, Konbit Sante has promoted and supported the work of community health workers. Community health workers often live in the community that they serve, and they visit others, children, families, households to offer education, to make referrals to health center, and to provide essential services such as childhood vaccinations, and to teach about a variety of health issues. In just the past year, the community health workers that work out of Fort Saint-Michel visited nearly 600 new mothers within a few hours of home births. They ensured that 6,000 children received their first doses and provided nutritional consultation to mothers of about 9,000 children under 5 years of age. So they're out in the communities and they're doing a great deal of work, as you can see here in this picture. The bottom line is that across all of our project, Konbit Sante leverages our resources, whether it's financial resources, human resources, and the expertise that our volunteers have. We leverage our resources to help patient health professionals and health institutions provide quality care. To talk about what we look forward to doing in the coming year is Perry Newman, our new executive director. As many of you know, I hope you know by now, Perry has extensive experience in international business, diplomacy, and leading nonprofit organizations in various stages of growth and development. We are thrilled to have Perry join us as the new executive director. Perry?
Thanks, Tetsuda. Good afternoon, everybody. It's nice to see so many familiar faces and welcome so many new ones, new to me anyway, and thanks all of you for taking the time to join us today. I'd like to make a few observations based in part, of course, upon Tetsuda's presentation and her vast experience in Haiti, but also based upon my own impressions after having visited Haiti quite recently and having met with our in-country staff and the leadership of our partner organizations. Rather than approaching things from a public health perspective, however, my comments today are going to come from what you might call a management perspective. Now, stay with me here. It will not be painful. I'll go briskly and hopefully productively. Now, you might be wondering what useful perspectives I could offer, considering that I have, as Tetsuda and Eva have mentioned, such a short tenure at Konbit Sante, and that's fair enough. But having led and worked in international environments and nonprofit organizations for some time, there are a few things I'd like to share with folks today that I think are helpful in detailing Konbit Sante's work, our impact, the challenges, and importantly, our opportunities. The first is, and as everyone knows, either from experience or even from watching news, is that Haiti presents unique challenges for individuals living and working there, for families simply trying to get by, and for organizations like ours. Government instability, poor infrastructure, security issues, natural disasters, and it must be said, the legacy and continuing role of outside actors all have made Haiti what our board president, Eva, whom you met earlier, calls a, quote, complex operating environment. Put another way, in the words of a Brazilian development worker with longtime experience in Haiti, Ricardo Saitenfus, Haiti is not a place for amateurs. So among the things I'd like for folks to take away from our presentations today is that Konbit Sante's DNA, our underlying operating system, if you like, is not simply to drop into Haiti, tell people what they need, substitute our own judgments for those whom we serve, distribute supplies, and then go home. Now, we've been on the ground for 22 years. We're based at the Justinian Hospital, one of the largest public hospitals in the North. Our medical staff and community health outreach workers are Haitian, and everything we do is driven by the notion of tête ensemble, which you might translate as a collaboration of putting our heads together to come up with solutions. We're a well-established part of the landscape, and I think it's fair to say, while there's always room for improvement and so much more to be done, we're not approaching these challenges, as Saitenfus might have put it, as amateurs. We know kind of what we're dealing with. A second management perspective, and one that flows from the first observation, is that while every organization needs to plan, both in preparing its budget and in delivering on its programs, there are many aspects of working in Haiti that make planning, shall we say, particularly challenging. There are things you can anticipate and things you can't. And there are things that happened last year that may never happen again. And there are things that haven't happened in decades and that all of a sudden have happened. And then there are things that happen for the first time. All of which means that planning for known unknowns is sort of the order of the day. But from a management perspective, it's difficult to attach numbers or timeframes or dollars and cents to things. Yet it's clear we need to assume that at some point, at least some things will not go according to plan. And as the saying goes, and I don't know if there are any German scholars out there, but it's an expression I like, man tracht und Gott lacht, which means man plans and God laughs. and it applies in particular to work in Haiti, I think. So consequently, going forward, we're going to be focusing on building up our funds and other resources to account for the inevitable and predictably unpredictable, if you like, contingencies. The last observation and perspective I'll share today follows once again from the first two, and it also ties into the notion that working in Haiti must, if it is to be effective and not performative, must involve follow-up and follow-on efforts. I mentioned a moment ago that one thing we are committed to not doing is simply rounding up surplus and leaving it at the doorsteps of clinics. Let me emphasize again that there will always be a need for relevant materials and medical goods, and I am not casting aspersions on efforts to supply these basic needs, far from it. What I am saying is that when we are trying to make sustained and systematic change, we have to do more than that. Over the years, for example, some of our partner institutions have acquired equipment that, for want of spare parts or want of a skilled biotechnician, have fallen into disrepair or are not reliably operable. So there are few trained biotechnicians available in Haiti. And of course, while it would be helpful to bring in such biotechnicians from outside to do some repairs and to train local partners in making these repairs, the more sustainable solution, and one that helps to make the sustained systemic improvements we seek, is to explore hiring and training a dedicated biotechnician who can service the hospitals and clinics with which we partner. Now, even so, that biotechnician will no doubt from time to time require parts or other items on hand to make repairs and adjustments in real time. So in order to plan for these unknowable knowables, we need to explore reliable backup systems, both in terms of materials and human resources, all of which relates to and leads us to kind of a risk assessment, both organizational with respect to what Konbit Sante's risks are, and how those risks are impacted by environmental risks. And we'll be looking to do so that we can continue to provide the planning and the treatment and the management, the day-to-day and the longer term interventions and foundation building necessary to achieving our mission. The nuts and bolts organizational managerial stuff isn't always visible to the naked eye. But as we look forward to another 22 years plus of service to communities in Cap Haitian, I think attention to these operational aspects of our work will give us the best shot at making an even greater impact. And that's where I think you'll see, or perhaps not see, many of our efforts. But rest assured, we will be doing them. And I'm confident that the impact will be seen and felt on the ground and in the lives of those we've served. And with that, I'll thank you for your attention and turn it back to Eva.
And thank you, Perry. Thank you, Tezida. I know it's hard to be in the spotlight. It was terrific to hear from both of you. Perry, I love, you just started and you seem to have been able to understand a lot of the complexities from one visit to Haiti and a month plus of working with us in a way that can take people many, many years. So I love hearing your remarks today, and of course our one-on-one conversations have demonstrated that as well. So thank you so much for that. And Tezida, I know you only picked 3 of the buckets of work that are core to our work in Konbit Sante, and I know there are many more. People may have questions about those, but we've got about 15 minutes for discussion. There are people who are new to Konbit Sante on the line. There are people who've worked with and been friends of Konbit Sante for many years on the line, and you may have pieces that you're interested in that you know exist that you didn't hear about that you may want to, or questions about direction or anything else that might be on your mind, Haiti in general. So please speak up. So we've got one question about how is the partnership, whoops, it went away, come back. How's the partnership with the 4 hospitals? How is that done? So how do we coordinate our partnerships? And I think the question is also about what's our specific role. I love that question, actually. What activities are we involved with? So maybe, Tezida, maybe I'll give that to you first and then you can pass it to Perry. you see that question? How is the partnership carried out with the 4 different hospitals or centers? What are the areas of interest and what are the activities and what's our role?
So let's see. What typically happens is that each year we have meetings with the leadership of each of the partners facilities to review what we've done together in the past year and to plan for the following year. What we try to do, again, in conversation, in discussions with our partners, is to identify gaps in those building blocks that I shared with you, whether it's staffing or materials or management practices, infrastructure, identify gaps in one or more of those building blocks that Konbit Sante has the resources to meet, and then develop a plan for the year or next several years that maps out how Konbit Sante and the partner will go about addressing that gap. So that's typically how that works. It's needs-based. Projects are identified with partners. We develop long-term plans, and we identify what Konbit Sante's contribution is to the project or plan, and what the partner's contribution is to the project or plan, and then meet on a regular basis over the course of the year or the 2 or 3 years of that project's lifespan to discuss how it's going, what needs to be changed or tweaked, what needs to be, just to let go of because it's not working. And all of that is codified in an MOU between Konbit Sante and the partner. Did I answer the question?
I just say thank you.
Okay,
Thank you.
good.
She answered.
Good. It's a great question. Thank you. EJ, go ahead.
Hi, Eva.
Hi.
Eva, could you or whomever you wish to direct it to talk about the relationship between Konbit Sante and the greater CAP business community?
I can start and then I'll pass it to both Tezida and Perry. One of the ways that we connect to the greater business community is through our board. Pascal, who's one of our board members, has led that charge in really connecting the organization to the greater business community, trying to build awareness of the organization, trying to build some fundraising chops within the business community, trying to get input from the business community about what is most important to them, for example, and how we might continue to support the Justinian, how we continue to function in times of great insecurity, how we continue to strengthen partnerships in and beyond the business community, but in the civic organizations beyond health. So she's really led that piece for us. Tezida, maybe I'll go to you and then to Perry if you have any other remarks, and then Nate, you're not a presenter today, but you're certainly welcome to add.
And so I did hear Eva's response, and I think she's absolutely right. That relationship is deepening, particularly with the business community in CAP, largely due to the efforts of our board member Pascal, who unfortunately was not able to join us today. It's a work in progress, but I see they certainly value the work that Konbit Sante is doing, and they are willing to support our efforts. They're very much interested in improving the quality of care at Justinian in particular. As you know, Justinian is the second largest public hospital in the country. It's based in CAP. It's where our offices are located, or our office is located. There's a desire among all members of the community, both in the business sector and just families in CAP. They want to see that hospital function well and to the benefit of the community. And I think we're seeing the business community look to Konbit Sante as a partner that can make that a reality. So I'm very excited about the direction we're moving in with Pascal's support. And as I said, it's a work in progress. We have more work to do, but we're getting there.
A question a few minutes ago from Pascal Cayette regarding what relationships, if any, we've developed with the educational system, whether that presents any opportunities for us. And so forth. My understanding, and again, with the enormous asterisk over my head that says new to the organization, is that we're highly focused on what we can control and what we can do in the Cap Haitian area, and have made a conscious effort to focus our efforts there without delving into the world of policy. As an outsider looking in, and as I get my feet wet, I know from prior experience that it's a bit dicey to become involved in the political affairs of another country, no matter how well versed you are in them. And so my inclination and I would say my overall management philosophy is to, as they say in the building trades, to measure twice and cut once. So I would be very, very cautious about doing more than what we're really, really good at, which is to build the systemic healthcare system and to focus, to stick with our knitting, as we might say.
I think to the extent that we have any ties to the education system, it's through the community health workers who organize outreach, health, and do health education in the schools, offer vaccination in schools. It's very circumscribed and it's focused on health. Beyond that, we, up to now at least, have not had strong ties with the education sector in CAP.
Thanks, Tessa. As happens in these things, all of a sudden we have lots of questions and 5 minutes to go. So I'm going to keep moving. And I think I'm going to combine Spencer and Allison's questions to some extent. The first part of Spencer's question is about how the diaspora community can become involved or become more involved, and if there are any partnerships with organizations outside of Haiti. The second part, which is similar to Allison's, is about whether or not we have any plans to expand into other regions. How do we leverage everything we've learned and our model to have even better coverage than we have now? So those are two big questions.
Sure. One of the things that I've been doing as I get acclimated is to begin to explore where the significant pockets of the diaspora, the Haitian diaspora, and others with a strong interest in conditions and improving lives and general productive partnerships in Haiti, where those pockets reside. And obviously Spencer Guillemette and I know each other a little bit from the Boston area, and there is a significant Haitian community there. And one of my former colleagues in Boston is very active in a number of those organizations in the Boston area. So we are planning to do a bit of a foray and to pursue some of those introductions to enhance our profile a little bit. But one thing that was very interesting for me to learn is that there is an organization in Boston that seeks to bring medical residents from Haiti to some of the hospitals in Boston or to clinics in Boston so that they can have an extended period of training and then, of course, return to Haiti. So with partnerships of that nature, and I'm sure there are more of them out there, we can help to make a greater impact. I will say, and I'll turn this over to Tetsuda in a minute for what I like to call rebuttal, is that as far as expansion is concerned, I'll harken back to my comments to Pascal a few moments ago about being very, very strategic and defined about where we do our work. But we do have an intention of formalizing a partnership with a fifth institution in the Cap Haitian area, which is a very strategic opportunity for us. And that is an area of sort of organic growth, but with a purpose, but helps us to do more of what we do in a slightly different geographic area within our overall footprint. So I would say, very, very carefully, strategically, and mindful of both resources and overextending ourselves.
Thanks, Barry. That's great. Charlot, you're up. I know you've been holding your question.
Thank you. I first want to say welcome aboard, Barry. We are all excited we look forward to working with you. And I love the idea of your bringing your managerial expertise and to couple it with the public health expertise of Konbit Sante, and the idea of leveraging local expertise by training, for example, biotechnicians is, of course, a great idea. I think a few of us might be aware of some local entities that are trying to promote professional and vocational schools in the northern region of Haiti. And I'm thinking if you look at it from a perspective of ecosystem that will benefit or that will improve the larger well-being of the community, there might be a way to partner with those professional and vocational schools to further expand on the pool of technicians that might be available in a range of technologies, right? Either biotechnicians or people who are into electricity or infrastructure building. So just to support what you say, if we can further promote these partnerships, investigate who are those local organizations that are doing professional and vocational schools, and then see how we can build this relationship.
Thanks very much. That's a terrific suggestion. And for some who know, I mean, I will be visiting the gang in Cap-Haïtien beginning on the 9th of January, and hopefully perhaps there's even something I can do while I'm down there to begin to put a toe in the water.
Terrific. We had one last question in the chat from Pierre. Pierre, now I'm trying to find it because it was up a little bit. And you were asking about the breakdown of our current funding resources. And I wonder if you can put your email in the chat if you don't already get our annual report. We'd love to add you to our list. But if anybody wants to answer that.
Pierre is an old friend of mine.
Wonderful.
And I appreciate the question. He's also a very experienced grant writer and fundraiser and has worked with many, many organizations. At present, I would say probably 2/3, 60% thereabouts come from private donations, family foundations, individuals, and the remaining portion come from grants, ongoing grants, some of which come from the U.S. government, USAID, and other organizations, international organizations that provide for sort of ongoing support for longer term projects. But individual and smaller donor support is critical to what we do. And of course, part of my work will be to widen and deepen the base of our support so we can do more of what we do with greater sustainability.
It was a great last question and a great response. As a reminder, I think that we are so incredibly grateful to everybody on this call and all of the friends of Konbit Sante who continue to be friends both in support and including financial support over the years. We most certainly could not do this without all of you. And we want to continue to hear from you in forums like this. We appreciate that you took the time today to join this. Some of you also joined an in-person event earlier this week. We'll continue to have events like this periodically throughout the year so that we can answer questions that are hard for you to get answered through other ways throughout the year. So we'll continue to do that. We had 20 minutes for discussion and we used it all. I'm sure there will be lots of other questions that come up over time. If you're not on our email list for the annual report and other communications, please send that to us. You can put your email in the chat if you're not already, and we can capture that. And with that, I think I'll just say thank you again to everybody. Please continue to stay in touch. Have a good holiday season if this is your holiday season. Continue to do good work and keep Haiti and Konbit Sante on your list of friends. Thanks very much, everybody. Thanks for joining.